When you or a loved one with chronic obstructive pulmonary disease, or COPD, is in the hospital, there are many tests and observations healthcare providers perform to ensure the best possible care. It is natural to feel a bit overwhelmed or curious about what all these procedures mean for your health. Among these important assessments, one might hear about a neurological examination, which plays a crucial role in monitoring your well-being. A neurological exam for COPD patients in the hospital is a systematic assessment of the brain, spinal cord, and nerve function. Its primary purpose is to quickly detect any changes in a patient's mental status, coordination, reflexes, or sensation. These changes could indicate complications related to their COPD, such as insufficient oxygen supply to the brain or an excess of carbon dioxide in the blood, which is known as hypercapnia, affecting brain function. The why behind this exam is rooted in the physiological impact COPD can have on the body's delicate balance. Severe COPD exacerbations, or flare-ups, can lead to respiratory failure, meaning the lungs struggle to get enough oxygen into the bloodstream and remove carbon dioxide. Both low oxygen levels, called hypoxia, and high carbon dioxide levels directly affect brain cells, potentially causing confusion, drowsiness, headaches, or even more severe neurological symptoms. The exam acts as an early warning system, helping doctors pinpoint these issues before they become critical and allowing for timely intervention. When a healthcare professional performs a neurological exam, they typically evaluate several key areas. This includes checking your orientation to time and place, assessing your memory and attention, and observing your speech and language abilities. They will also look at your motor skills by asking you to move your limbs, checking your muscle strength, and testing your reflexes. Simple requests like following their finger with your eyes or squeezing their hands are common. These observations provide a comprehensive picture of how your nervous system is functioning in real time. One insightful detail is the pupillary light reflex test, where a doctor shines a small light into your eyes to see how your pupils react. This can indicate pressure changes within the brain or nerve damage. Another important sign is tracking for asterixis, sometimes called a flapping tremor, which is an involuntary jerking movement of the hands. This specific sign can be a red flag for high carbon dioxide levels, indicating that the patient's breathing is not effectively clearing this waste product, a condition that needs urgent attention. Understanding that a neurological exam is a standard, non-invasive tool helps ensure that COPD patients receive comprehensive care during their hospital stay. It is not something to be alarmed by, but rather a proactive measure. This routine checkup helps your medical team understand if your breathing difficulties are starting to impact other vital systems, especially your brain, allowing them to adjust your treatment quickly and effectively for your safety and recovery.